Good afternoon. Today, Canada has received troubling reports of potential restrictions to access to vaccines at a time when Canadians are increasingly worried about the spread of variants and potentially continued lockdown restrictions. We have heard that the European Union is about to pass legislation which would further restrict exports of vaccines, and we know that Canada is reliant upon production in the European Union for access to vaccines. At the same time, we are also hearing reports of the same situation arising in India. This is very troubling. Now, I do know that the federal government is out saying that they have verbal assurances from the European Union that this is not going to be a problem. However, the fact that I believe it's 92 other countries are on a list saying that this is not going to be a problem for them, but Canada isn't, is troubling. I think that at this juncture, it's incumbent upon the Prime Minister, after export restrictions in the EU have been problematic or a potential problem for weeks, that the Prime Minister needs to explain why we don't have written assurances. The Prime Minister also needs to explain and be very clear to the provinces on whether or not these potential export restrictions from both the European Union and India will have impacts on provincial vaccine delivery schedules. At this point in time, the provinces have been very clear that supply has been an issue, and supply has been a key component in whether or not provinces are looking at continued lockdown. So at this point in time, verbal, don't worry, everything's okay is not what provinces or any Canadians are looking for from the federal government. They're looking for certainty, and we do not have that today. So what we are looking for with the Conservative Party is written assurances from the European Union as well as other countries around the world on these particular schedules and whether or not we will be impacted by potential export restrictions, and then a plan and clarity from the federal government directed to the provinces so that they can plan accordingly. This is extremely concerning. Canada is already far behind most other developed nations around the world with regard to vaccination rollout. This has been largely determinant on the lack of supply from the federal government. To fall further behind because the federal government did not plan for a contingency, which should have been obvious to them, is very, very troubling, and every Canadian should be concerned about that. Thank you.
And we'll now take questions, alternating between the phone and the room. One question, one follow-up per reporter. We have approximately 10 minutes. Nous avons 10 minutes pour les questions, en alternance entre le téléphone et la salle. Une question suivie par journaliste. Operator, do we have a question?
Thank you. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There are no questions registered at this time. Nous n'avons pas de questions pour le moment. I would like now to turn the meeting back over to you. Thank you.
Perfect. Mike?
So when you say that it's not good enough, you want something written, given that it seems like this government didn't have anything in terms of written down from either the EU or some of these contracts, how much of a problem is that in terms of just trying to go with the just trust me?
Yeah, well, it's highly problematic. I mean, to put it mildly, I actually think that's a deadly lack of detail. 92 other countries have received written exemptions from the EU. We have been talking about this issue, that is export restrictions from the EU, for months now. And now the rubber is hitting the road. With the spread of variants being a cause for concern for provincial governments with regard to potential further lockdown restrictions, we need certainty. A wink and a nod is not going to cut it today. It's not going to cut it for anybody who's concerned about their health or any business owner who's looking for some glimmer of hope with certainty on the vaccination schedules. I was actually shocked that the Prime Minister didn't announce written assurances today. This has been a problem for months. What have they been doing during this time?
As a follow-up, I wanted to know if you think that the extra doses of AstraZeneca coming from the U.S. and the possibility that the Americans not needing as much Pfizer anymore because they'll be fully vaccinated and now being able to share with Canada, do you think that that might actually help Canada and not having the issue of worrying of, are we going to get some from India? Are we going to get some from Europe?
It's a great question. 2 points. First of all, the AstraZeneca doses that have been quote-unquote committed to Canada from the United States. I don't believe they've arrived yet, and they're technically on loan. We don't have understanding of what that means. So if they're on loan from the United States government, are we under obligation to repay those doses to the U.S.? And if so, how does potential export restrictions from the EU and India factor into that? That's something that the Prime Minister needs to explain, particularly to provincial governments who are trying to explain the vaccine rollout schedule. The second thing I'll note is that President Biden has been very clear that his plan is to accelerate the rollout of vaccines across the United States, and we've seen that happen. And congratulations to American colleagues for getting that done. At this point in time, I've seen no indication either from the Prime Minister or from the that there has been any assurances given to Canada or any certainty on extra doses coming from the United States. The thing that I've heard is very clear direction from the American president to their people that the American people will be prioritized with vaccinations. So how Canada falls into that, is unclear to me. So again, these are questions for the Prime Minister. Trudeau needs to explain again to the provinces the answer to both potential supply from the Americans, whether or not we're going to have to repay the Americans with AstraZeneca doses from now potentially restricted doses in the EU and India, and also why 92 other countries have written assurances that they will not be impacted by export restrictions from the EU, but Canada does not, after months of raising this as an issue. What have they been doing during this time?
Operator, do we have a question on the phone?
There are no questions registered at this time.
Back to the room. Stephanie?
You were early and caught everybody off guard. Sorry. That's okay. Stephanie Levitz. It's unusual, we will admit. Stephanie Levitz, the Canadian Press. Okay, so we're at a point where we are really at the whims of other countries for when we get our vaccines. Right. And your party and others, have said, no, we need to do this at home. So at what stage is your own party's research at for ideas on how that could happen at home and what actually needs to happen to avoid this for future crises, because to deal with this one is simply too late, one would presume? Perfect.
Myself and our party leader, Erin O'Toole, have been meeting with stakeholders who potentially have manufacturing capacity across the country, trying to understand what potential capacity exists and where the roadblocks lie and why they haven't been engaged in both federal procurement but also federal assistance to ramp up domestic manufacturing capacity. We've been moving motions within our industry committee, bringing expert witnesses to testify exactly to that. It is low-hanging fruit and baffling to me that the federal government has not reached out to companies, for example, like Providence Pharmaceuticals in Alberta to say, what can we do to help? How can we do more? And, even though there's been some discussion of this, it really hasn't been tied to any sort of metrics on clear delivery or path forward. Obstacles with regard to paving the way on the regulatory process to make this more efficient and more effective haven't been dealt with. And I just don't think that the federal government has exercised political will in this regard. I think we are in an emergency situation. Capacity to manufacture a critical product like vaccines at home is critical to securing Canada's future. And again, as my party leader reiterated in his speech on Friday to our delegates, this will be a key priority for our party in the next year and in any potential election campaign going forward.
I'll just pick up on the issue of metrics because I believe your motion on the question of having some kind of metric, science, data approach to reopening is up for a vote.
It is.
Today, right, after QP?
It is. And I mean, at this point in time, what we are demanding of the federal government should be able to tell Canadians how many doses of which vaccines we're expecting under what period of time. The question you just asked about domestic manufacturing capacity, when and if and how that is going to come on stream. And then also what work is being done to tie vaccination rates to benchmarks related to reopening. It is unacceptable that the federal government is not providing resources or tools to provincial government with regard to guidance on how vaccination, rapid tools, therapeutics, and other data can help to protect the country against the spread of COVID while looking for a solid reopening plan. So that's really what the motion is about today, but also recognizing that there are areas of restrictions that are solely within federal purview that they have not given any detail about. So we're a year into this. The tools exist. It's clear that Canada, under this federal government, has not had an adequate plan to secure or deploy them. And today is about demanding better for the Canadian people.
I didn't get a question in.
I'm sorry. I have time for one more question.
I didn't
have to
actually
check.
get a question there, though, Christine. No, I
I'll
started to
take
say
it.
hey about your motion, and then Michelle.
Sorry, I thought you were done. I do that
it's
to my
okay. It's
husband
okay.
all the time, Stephanie.
But I just want to know. I asked this question to Jagmeet. What is the metric from a COVID perspective that you'd be looking for to consider it safe to call an election?
We're not looking at calling an election right now. Every Canadian across the country, I don't think that's where their headspace is at. Their headspace is at how are we going to safely reopen the economy, and that's what the federal government needs to answer. And sorry for cutting you off, Stephanie.
Okay. Sorry for misunderstanding too. So I was given one last question. I'll check on the phone once more if we have a question. Operator?
And there are no questions registered at this time.
And the last question will be in the room.
Yeah. If we just take a step back, the EU is our ally, and they've joined us on so many issues, including, standing up to China when it comes to the issues with the human rights abuses against the Uyghurs. Are you surprised with this move? Is this the right move for the EU to do, given that, China and, other countries are giving away vaccines? Vaccine diplomacy is a thing.
I need to understand what Justin Trudeau negotiated with the European Union and why he apparently has been unsuccessful in achieving a written agreement with our ally, as 92 other countries have done. I think that that's a question for the Prime Minister.
I mean, I know you want to understand that, but I mean, you're a Canadian politician, and you're on Team Canada. Are you surprised with what the EU is doing here?
I think Justin Trudeau has failed Team Canada. After what happened at the start of the pandemic with regard to the rush for personal protective equipment and the protectionism that we saw around the world at that point in time, it shouldn't have come as a surprise to the federal government that countries were going to try and secure domestic production of vaccine for their own persons. We should have been securing written assurances from our trading partners in this regard, but we also should have been shoring up domestic manufacturing capacity. But woulda, shoulda, coulda is not going to vaccinate people now, and it's up to the Prime Minister to give those written assurances, secure them, but also explain to the provinces what the likely scenario is for vaccine receipt in the next several weeks. Thank you.
And this is all the time we have.